All right, Felicity, we're ready to get started.
Thank you, Allison. Good afternoon and welcome to our fourth monthly office hours in our series. Each month, we have been reviewing a domain related to policy development and implementation, providing you with a tip sheet for putting policies into action, and providing a forum for questions and answers, as well as just-in-time technical assistance. Today, we will be reviewing policy implementation. Before we get started, I will briefly review our platform. You are currently muted and in listen-only mode. We will save Q&A for the end of the session. If you do have a question, please use either the Q&A or chat icons at the bottom of your screen, or feel free to enter your questions throughout the session, and they will be answered at the end. The resources from today's session will be provided in chat. We want today's session to be interactive, so we welcome you to use the chat to share your experiences and be engaged. When using chat, please be sure to select the option to send to all panelists and attendees. Today's session is being recorded, and you will receive a link to the recording within 24 hours. We will disable recording at the conclusion of our presentation and before we invite participants to ask questions. If you encounter audio challenges, click Audio Settings in the bottom left-hand corner of your screen to adjust, or you can also listen by phone. The telephone number was provided in your confirmation email. Again, good afternoon, and thank you for joining us. I'm Felicity Wood, consultant with Health Quality Innovators, and my colleague Allison Spangler, project manager, is joining me on this webinar. We have partnered with Leading Age Virginia on this initiative. Our Leading Age partner, Betsy Archer, is also on this webinar with us today. This project is funded by the CDC through the Virginia Department of Health. Our goal is to provide model infection prevention and control policies for consistency among all licensed adult day centers in Virginia. It is also our goal to assist you in adopting and implementing these policies at your center. We are accomplishing the goals of this grant project by engaging with a work group comprised of leaders and stakeholders from adult day centers. These individuals from Virginia are developing and editing the model policy templates for this project, which will be shared with you for use in your center. Some of the work group members are on this webinar today, and we thank them as always for their efforts. To date, the work group has edited and distributed 11 policy templates for the topics listed on these next few slides. These slides provide links to each of the policy templates for ease in access and use. If you're receiving our Friday emails, you will have received links to these policy templates as well. Here are 4 finalized templates on the topics of hand hygiene, respiratory hygiene and cough etiquette, selection and use of PPE, and blood glucose testing. Just a reminder that these policies are not a one-size-fits-all. Rather, they are templates that are designed to be customized by you to meet the needs of your center. Here are 4 additional finalized policy templates with links. These policy templates are auditing, monitoring, and compliance, environmental cleaning and disinfection, participant care equipment, devices, and supplies, and injection safety. Here are the most recently finalized policy templates, and they include laundry and linen management, integrated pest management, and biohazard waste disposal. Our suggestion is that you download the policy templates, conduct a policy analysis or readiness assessment, and compare the templates to your current policy and practice. The policy template may suggest a new or slightly different procedure that is reflective of a best practice, or it may elevate your current operations to further prevent infections. We encourage you to work towards adopting the recommended procedural steps and best practices where applicable. Keep in mind that any practice described in your policy becomes the standard by which you are evaluated during your on-site surveys. Here's a quick recap of the office hours in July, where we reviewed policy enactment, which is the process of obtaining permission to move forward with using a policy. While policy enactment at first blush may seem like a step that can be bypassed as mainly a paper compliance step, centers should have a process in place that they follow for every policy, whereby they first obtain approval to use that policy. Approval for use of a policy is important because it validates by management and or leadership that the procedural steps outlined and written into the policy meet operational objectives. This step provides the support and backup to leadership and staff to uphold the policy. Once you have approval to use your policy and make it actionable, you move into the policy implementation part of the process, and this is what we will be discussing today. To turn our focus to today's office hours topic, we have a quick polling question for you. Will you please answer this question? What steps does your center take to implement policies? 1, distribute and document to all staff. Require staff sign off on new or updated policies. Provide training on changes in practice reflected in the new or updated policy. Allow a period of time for staff to ask questions or provide feedback about the changes in a policy, or all of the above. You can select more than one response. Can you please make your selection now?
And we'll give everyone just a couple more seconds.
Wow, great. Thank you, Allison, and thank you for your responses. It looks like we have about 40% and 40% of participants requiring staff to sign off and providing training, and 60% said all of the above. So that's great. For those of you who answered all of the above, you are well on your way to a robust policy implementation practice at your center. We will be reviewing some of the key components of policy implementation, and you can check your process against the information shared today. Policy implementation, why is it important? Well, implementing a policy is the process of putting a policy into action or the execution of a policy. Implementation is the interaction of the operational goals of an adult day center and the actions needed to achieve those goals. A policy won't work if policy implementation does not occur because the individuals who are responsible for carrying out the procedural steps in the policy will not know that the policy has been created or revised. Leadership at an adult day center must operationalize the policy and put it into practice as it is written. You must also complete education and training for all staff so that they are aware of any changes to practice reflected in the policy. Without policy implementation, your staff won't know who is responsible for performing the steps in the policy, and therefore they won't be able to change their practices or behavior to comply. So who's involved in policy implementation? Well, that is anyone with a vested interest in the success of your adult day center and who is supportive of your mission and successful operations. You know the importance of policy implementation, and now you want to know how to do this at your center. Policy implementation should involve several individuals who are coordinated in their efforts and form a team. This implementation team should complete several tasks for proper policy implementation. Those tasks fall under the categories of leadership, communication, and feedback. In the category of leadership, your policy implementation team should develop an implementation plan, including how you will provide staff training. Establish a scheduled review process for policy revisions and updates, and plan for sustainability of policies. That is, how are you going to continue to make these policies relevant and applicable? In the category of communications, your policy implementation team should distribute the policy and document that it has been reviewed by staff, whether in town hall, staff meetings, or one-on-one meetings. Communication also includes the education and training for all impacted staff. Feedback by your implementation team includes observing behaviors and practices for policy adherence, documenting staff training and compliance, and auditing and validating compliance and consistency. And don't forget to plan training upon hire and at least annually or as changes occur. Simply put, Implementation of a policy includes 3 points, which are education, changing or creating systems, and monitoring compliance. Policy implementation includes educating those who will be affected by the new or revised policy. Policy implementation includes reviewing, changing, or modifying pre-existing or prior operations or systems, or creating new. And policy implementation includes monitoring and enforcing compliance with a policy. How about some ways you can improve policy implementation and even streamline the process at your center? Be sure you have goals and a plan in place to achieve those goals. Gather your team and assign roles and responsibilities. Be sure you're consistent in your implementation process. Each policy should be implemented the same way. And don't forget to communicate the policy and any changes. Publicize your policy with a go live date. Monitor progress and compliance with the policy. Adjust course if needed based upon feedback and any issues you may have encountered. And update and revise your policy at least annually and as needed. For example, when standards change or your center's practices are modified or changed. And keep up the momentum. I had the opportunity recently to speak with an executive director at an adult day center in Richmond, Virginia, about the impact of policy implementation at her center. With her permission, I'm sharing here what she told me. Heather shared with me that policy implementation has allowed her team to improve operations because they're more consistent in the care they provide to their participants. She also told me that her staff have a clear understanding of what is expected of them, and they value and appreciate that clear roadmap being provided to them by their managers. Heather also stated that being clear is being kind, and the clarification of expectations that policy implementation has afforded her team has led to great outcomes for their center's participants. Policy implementation really does have beneficial results, so don't hesitate to incorporate this process into your center's operations. The work group I mentioned at the beginning of this webinar has been working diligently to develop and edit model policy templates for this project. They have recently finalized 3 new policy templates that I'm going to share with you today. We will continue to share additional policy templates in the future office hours as they too become finalized. All policy templates developed through this project meet the standards and regulations set forth by VDSS. All policy templates have been reviewed by a team of infection preventionists for content and accuracy. And these templates have also been reviewed by VDSS to ensure the templates do not conflict with or make it more difficult to comply with adult day center regulations in Virginia. The first policy template I'd like to share with you is laundry and linen management. This template reviews the appropriate management of the laundering process to include transporting, handling, and processing, which is the washing and drying and storing of laundry and linen in a manner that minimizes the risk and spread of infection. This policy also provides procedural steps to minimize the risk of injury from sharps. As soiled and dirty are terms that are generally used synonymously in this context, you will see that for the purpose of this policy, the terminology used laundry and linen has been adopted. This policy covers both the procedure if an adult day center uses a contract laundry and linen service, or if these services are done in-house. Additionally, this template covers the importance of proper transportation of used laundry to either the laundry processing area or to the storage area awaiting pickup by the contracted service, and also the storage of clean laundry and the designation of an area that serves for this purpose. The second policy template to share is pest management. While this may be a topic we would love to not to ever have to endure, pests are a fact of life, and an effective infection control program includes a pest management policy. This policy template includes pest prevention, pest reduction, and the elimination of conditions that might lead to a pest infestation. To accomplish this template is broken down into sections that cover guidance on topics such as inspection and monitoring, elimination of conditions that attract pests, keeping pests out of indoor environments, use of traps and application of pesticides, and ensuring staff and participant safety. The notes and recommendations section of this policy template also provides a link to a reference manual to provide you with additional information on common pests and vermin to be aware of in your center and how to combat these pests. Finally, I would like to share the regulated biohazard waste management policy template. This template covers the importance of handling and disposing of regulated waste according to OSHA and VDEQ guidelines and in accordance with your center's bloodborne pathogen exposure control plan. Specific safe handling requirements must be followed to prevent the potential for transmission of communicable diseases to staff and participants. This policy template details the disposal of contaminated sharps as well as other types of regulated waste. This policy template also refers to other sharps and recommends that a center assess and evaluate all items on their premises, which upon breaking could be sharp and potentially puncture skin, because they would then need to be disposed of according to this policy. Does your center have glass decor like vases or picture frames? If the glass in those items breaks, it has the potential to become an other sharp, and the disposal process should be handled by following this policy. After reviewing these new policy templates, you have any questions, please do not hesitate to reach out to further discuss. Are you ready to start implementing these policies at your center? And you're asking, where do you start? To define where you're going, start by forming the policy implementation team to assist with the efforts, as you are only one person and you need support and help of others. How you will get there is by deciding upon a plan and a goal to implement your policies. Be specific, as a well-defined objective should be crystal clear for you and all who are involved. Be sure to formulate your rollout, communication, and education plans. Decide how you're going to accomplish these things and who is responsible for the various tasks. Next, assess your progress. Are you on track, or do you need to pivot and change course? Be sure to measure your progress by setting timelines and then analyzing what was accomplished and what still remains. Circumstances evolved. Time is a commodity in short supply, so don't be afraid to adjust and adapt as needed. And finally, the only way you're going to arrive at your goal or your destination is to keep moving. So break your plan down into manageable pieces and take action. As we conclude today's office hours, we'd love to hear from you. Can you please provide feedback on the resources developed by this project so far? We'd like to know if and how you have used any of the resources, including any of the policy templates and tip sheets. Please use chat to type in your feedback now. Have you downloaded any of the policy templates? Have you implemented any of the policy templates? Have you updated your current policies with any of the best practices provided? Or if you haven't taken any steps yet, how do you plan to get started?
Hi, Felicity. So someone shared that the templates are fantastic and the facilities I'm working with are in the process of updating their policies.
Great, good. Wonderful. Allison, any other answers coming through chat?
Not at this moment.
Okay, well, thank you. It appears as though some centers are already started using some of the policy templates. Hopefully more and more centers will be looking to use these templates to assist them in their operations. Please let us know what additional information may be needed to assist you. Please mark your calendar and use the link on this slide to register for our next monthly office hours session, which is Policy Development Wrap-Up and Overview. That'll occur on September 14th at 2 p.m. We will also share additional policy templates that have been finalized since today's webinar. We will stop the recording now and open the session for Q&A. As a reminder, you can enter your questions by using the Q&A or chat icon at the bottom of your screen. If you'd like to ask your question verbally, click raise your hand using the reactions icon and we will unmute you. Are there any questions?